Welcome to Veterinary. In this video, I'm going to talk about anemia. So anemia is defined as decrease in hemoglobin concentration or decrease in RBC mass or both as measured by packed cell volume, hematocrit or RBC count. So what is anemia? It is either decrease in hemoglobin or decrease in RBC or both. And it is measured by PCV, packed cell volume, hematocrit, which includes MCV, mean corpuscular volume, and MCHC, mean corpuscular hemoglobin concentration, and RBC count, that is TEC, total erythrocyte count. Okay, so clinically it is classified into two types, regenerative and non-regenerative anemia. The hallmark of regenerative anemia is reticulocytosis, except in case of horses. Okay, so what is reticulocytosis? It is increase in the number of circulating reticulocytes that are immature erythrocytes, and it is evident as polychromasia on a routinely right-stained blood smear. Okay, so this is a blood smear of ox blood, and it is stained by the right stain, and you can see this is polychromasia. Okay, these are reticulocytes. Okay, then with reticulocytosis, we also see one thing that is called metarubricitosis. So metarubricitosis is increase in the number of nucleated RBC, and it can be appropriate or inappropriate. So appropriate metarubricitosis is increase in number of nucleated RBC along with reticulocytosis, and this is seen in case of regenerative anemia. While inappropriate metarubricitosis is increase in number of nucleated RBC without any reticulocytosis, and this is seen in case of splenic dysfunction or lead poisoning or marrow disease, etc. Okay. One thing is special in ruminants, that in ruminants, reticulocytosis is often accompanied by basophilic stippling. Okay, so here you can see this is basophilic stippling. Okay, and this is seen in case of ruminants, but just like metarubricitosis, it can also be inappropriate, that means without reticulocytosis, and in that case it may be due to lead poisoning or some other causes. Okay, so the two main types of regenerative anemia are hemorrhagic anemia and hemolytic anemia. Okay, hemorrhagic anemia due to hemorrhage, that is blood loss. Okay, so hemorrhage result in escape of erythrocytes and other blood components such as protein from the vasculature. As a result, a decreased plasma or serum protein concentration termed hypoproteinemia may be evident on CBC or chemistry blood panel. Okay, so when there's hemorrhage, there's escape of RBC along with other blood components like protein, so we will have hypoproteinemia. Then if the hemorrhage is into the gastrointestinal lumen, so it is an internal hemorrhage, and the blood loss is going the blood is going into the gastrointestinal tract, then in this case the proteins are reabsorbed and converted to urea, resulting in an increased urea nitrogen concentration relative to creatinine in plasma. And hemorrhages within the urinary tract may cause red urine with erythrocytes observed in the urine segment, and this is called hematuria, blood in urine. Okay. One thing to note is when there's chronic hemorrhage, especially when it is external, so the blood loss is outside the body, so there's no way for the body to reabsorb the iron back, then in this case it may also lead to iron deficiency anemia. Okay, and we'll come to that later. So hemolytic anemia. Okay, this was all for hemorrhagic. Hemolytic anemia. Hemolysis means destruction of RBC. So when there's increased destruction of RBC, we call it hemolytic anemia. And you know that RBC contains hemoglobin. So when there's increased destruction of RBC, there will be release of free hemoglobin. And this hemoglobin is cleaved into heme. And this heme is then converted into bilirubin. So increased RBC destruction will result in hyperbilirubinemia, and this may lead to prehepatic jaundice. Okay, and how to detect prehepatic or hemolytic jaundice? By Vandenberg reaction. So positive, indirect positive will indicate hemolytic anemia. Okay, this is important. Indirect positive Vandenberg reaction. Okay, then when there's increased hemolysis, of course, as I said, there will be increased release of hemoglobin, right? Then when this hemoglobin exceeds by this amount, more than 50 mg per dl, what will happen? It will give pink color to the plasma, and this is called as hemoglobinemia. Then this excess hemoglobin is scavenged by a protein called haptoglobin, but this haptoglobin will get saturated with hemoglobin at the concentration 150 mg per dl. And what will happen if the hemoglobin exceeds this concentration? The free hemoglobin will pass through the glomerulus and will enter into the urine, and this is called hemoglobinuria. Okay, hemoglobinemia is identified by red coloring of the plasma, increased MCH and increased MCHC, while hemoglobinuria is detected by positive benzene test, also called pseudo peroxidase reaction. Okay, but do note one thing, that this benzene test, will give positive reaction to both hemoglobinuria and hematuria. So it will not answer whether you have hemolytic anemia or hemorrhagic anemia. Okay, it can be either of the two. Then hemolytic anemia is then further classified on the basis of the cause of hemolysis. Okay, so we can have immune-mediated, infectious, oxidative, and mechanical fragmentation, and also hypophosphatemia. So these are the things that you have to remember. So in immune-mediated, these are the things that will be present. In infectious, in oxidative, also in mechanical fragmentation. These are all important points, and I will go over some of them. So in immune-mediated, we said there are spherocytes, autoagglutination, and ghost cells. So what are spherocytes? Spherocytes are circular RBC, very circular, and they don't have any pale central region. So this is a normal RBC, and you can see that there's a central pallor, while these are all spherocytes. Okay, and they are as a result of immune-mediated hemolysis. Okay, and how to differentiate them? They don't have any central pallor. Okay, they have uniform staining, while the normal RBC, they have central pallor. Then autoagglutination, this is the clumping of RBC that you can see here. Okay, this is clumping of RBC. Then oxidative. One thing that I forgot to mention here, sorry. In this picture, this is a normal RBC, this is a spherocyte, and these two things which are present here, they are called ghost cells. Okay, ghost cells are present in all these subtypes of hemolytic anemia. And what are they? They are RBC which are devoid of their cytoplasmic contents. Okay, so because of hemolysis, all that hemoglobin and cytoplasmic contents of the RBC, they have escaped into the plasma. And what we have? We have empty cell. And this is called ghost cell. Why? Because it appears like this faint outline of a cell when you make a blood smear preparation. Then autoagglutination, I've discussed. Oxidative anemia. So in this case, we have three main things: Heinz body, eccentrocytes, and pycnocytes. So what are Heinz bodies? They are these protrusions. Okay, these small protrusions, these are called as Heinz bodies. Okay, and this is in the routine right stain. If you want to visualize them better, then you can use certain special stainings like this. In this picture, we have supravital stained blood smear, and you can appreciate these Heinz bodies very easily. One thing to note is that though I have said that Heinz bodies are characteristic of oxidative hemolytic anemia, in case of cats, they are normally present in low numbers. Okay, so if you are seeing a lot of Heinz bodies, then yes, it may be due to hemolytic anemia of oxidative cause. But if they are present in low number, in case of cats, they are normal. Then eccentrocytes, they are RBC in which one side has increased pallor, like this. You can see the contrast between this portion containing the hemoglobin and cytoplasmic contents and this portion which is devoid of hemoglobin. Okay, and please notice that it is having a normal shape, right? The shape is similar to that of a normal RBC, but we are seeing that one side has increased pallor. But what will happen if this portion is ruptured? This portion right here, if it is ruptured, what will happen? We will have a pycnocyte. And what is pycnocyte? Pycnocyte is this RBC. Just like spherocyte, it is again very spherical, but it has a ruffled border. Okay, this is the ruffled border that you are going to see in case of pycnocyte. Okay, pycnocyte, eccentrocyte, and Heinz bodies, they are seen in case of oxidative hemolytic anemia. Then mechanical fragmentation. In this case, there are three main things that we see: schistocytes, acanthocyte, and keratocyte. Okay, so what are schistocytes? They are RBC fragments, just like this. You can see this is an RBC fragment. Then we have acanthocyte. They are RBC with very long irregular projections. This is an acanthocyte. And then here, this is a keratocyte. And if you remember that in case of eccentrocyte, I said that the shape is similar to that of a normal RBC. We just have contrast. Okay, we have one very pale region and then one normal region. In case of keratocyte, this pale region is kind of protruding like a blister. Okay, so an RBC with a blister-like projection is called keratocyte. And these are the three main things that we are going to see in mechanical fragmentation. Ghost cells are common in all these types. Okay, in infectious, autoimmune, immune-mediated, oxidative, mechanical fragmentation, in all of these, you can see ghost cells. Then, of course, we have hypophosphatemic anemia. So phosphorus is involved in the production of ATP. And if there's decreased ATP production, then you will have decreased energy for the maintenance of the cell membrane. And this will lead to hemolytic anemia. Then there are two important things. One is Howell-Jolly bodies. This is also indicative of hemolytic anemia. These are the Howell-Jolly bodies, but just like Heinz bodies, they are normally present in very low numbers in case of horses, cats, piglets, and dogs. Okay. In other species, they are very much indicative of a pathology. And if they are present in large number in horses, cats, piglets, and dogs, then it may also be due to a pathology. Then what is crenation? Crenation is not abnormality in the RBC morphology. Rather than that, it is an artifact. Okay, it is a mistake. So if you are using some improper technique to prepare the blood smear, or you are using improper staining technique, if you have improper temperature, or you are not using clean glass site, then in this case you will see this artifact that is called crenation. And what is this? It is irregular RBCs. So you can see how the boundary of the RBC is irregular. Okay, so this is it for the hemolytic anemia, which is a type of regenerative anemia. Now let us come to the non-regenerative anemia. So in regenerative, we had reticulocytosis. In non-regenerative, there's a lack of reticulocytosis. One exception is there in case of horse. Even in regenerative anemia, you will not observe reticulocytosis. Okay. So there are various causes of non-regenerative anemia. It may be due to some bone marrow disease, that may be autoimmune mediated. It may be infectious, like feline leukemia virus, feline panleukopenia virus. There's equine infectious anemia. There's chicken infectious anemia, right? There can be many toxicities, congenital disorders, inflammatory diseases, renal failure, liver failure, endocrinopathies, and nutritional deficiencies, out of which iron deficiency, vitamin B12 deficiency, copper deficiency, phosphorus deficiency, we have already discussed, and vitamin B6 deficiency, they are the most important. And in this non-regenerative classification, the most important is iron deficiency anemia, and it is especially common in case of piglets. Hence, it is also called piglet anemia in them. And there's also another name which is commonly asked in the exams. It is thumps. There's decreased MCV and decreased MCHC. So the RBCs are called microcytic and hypochromic. There's another way of classification of anemia other than this regenerative, non-regenerative, and it is based on the size and pigmentation of the RBC. Okay, so MCV is used to determine the size of the RBC, while MCHC will talk about the hemoglobin concentration in the RBC. Right? So if there's less MCV, we'll call it microcytic. If it is more, then we'll call it macrocytic. If MCHC is less, then it is hypochromic. And if the MCHC is more than normal, then we'll call it hyperchromic. Okay, so RBC in case of iron deficiency anemia are microcytic and hypochromic. In case of ruminants, copper deficiency can also lead to iron deficiency anemia. Why? Because copper is used, or we can say copper is a component of this protein called ceruloplasmin, and ceruloplasmin is responsible for the absorption of iron from the GI tract. Okay, that is why copper deficiency can also lead to iron deficiency anemia in case of ruminants. Then anemia of chronic inflammation or anemia of chronic disease. This is due to inflammation. So when there's inflammation, there's increase in acute phase proteins like hepcidin. And what will hepcidin do? It will bind to ferroportin, and it will cause its degradation. And what is ferroportin? It is a cell surface iron efflux molecule. So what will happen if this is degraded? It will inhibit intestinal absorption of iron. Okay, because the ferroportin is degraded, what will happen? The intestinal cells, they'll absorb the iron, but this iron will not be transported into the bloodstream. So overall, the intestinal absorption of iron as a whole is inhibited. It will inhibit export of iron from macrophages and hepatocytes into the plasma. Cytokines are also likely to inhibit erythropoiesis by oxidative damage and triggering apoptosis of developing RBC. So in case of anemia of chronic disease, the RBC are normocytic and normochromic because there's decreased erythropoiesis. Okay. Then pernicious anemia and megaloblastic anemia, they are very similar. In case of pernicious anemia, there's deficiency of vitamin B6 folic acid. It is also called Addison's anemia. And what happens in this case, there's autoimmune destruction of parietal cells of the gastric mucosa. And what are parietal cells? They are cells that are responsible for the production of Cassel's intrinsic factor. Cassel's intrinsic factor is responsible for the absorption of folic acid. So when there's a decrease in the production of intrinsic factor, we will have a deficiency of folic acid. Okay, in this case, RBC are macrocytic and either normochromic or hypochromic. The main important thing is that RBC are macrocytic. Why? Because they are not fully matured because of the deficiency of folic acid. Then megaloblastic anemia, it has both the deficiency of vitamin B12 and vitamin B6. Vitamin B12 is cyanocobalamin, which is the maturation factor of RBC. So in this case, because of the deficiency of vitamin B12, the RBCs are megaloblastic, so they are immature, they are bigger, they are macrocytic, and they are hypochromic. Why? Because they are immature, they don't have the capacity to hold that much hemoglobin as a normal RBC. Okay, that is why they are hypochromic. Then at last we have aplastic anemia. It is due to bone marrow disorder. So the bone marrow is not able to form RBC. In this case, RBC are normocytic and normochromic, so they appear normal, but TEC, total erythrocyte count, is less. Okay, so this is it for anemia. If you found this video useful, then please hit the like button, share this video with your friends, and subscribe to my channel. Thank you.